Hello, my name is Sarah Metcalf, and I'm here to present the results of the association between sugar-sweetened beverage consumption and BMI based off of an analysis of the Behavioral Risk Factor Surveillance System. Over the last 3 decades, obesity prevalence in the United States has radically increased. Dramatic changes in eating habits and diet of our nation since the 1970s is believed to have triggered this increase, with sugar-sweetened beverage consumption being one of the main culprits. Sugar-sweetened beverages and obesity prevalence have shown to parallel each other, with both more than doubling over the years. So we wanted to ask, does sugar-sweetened beverage intake have an impact on BMI status? The methods used for this analysis, we took the 2016 Behavioral Risk Factor Surveillance System public use data file. BRFSS is conducted across the United States in collaboration with the CDC. It's a survey conducted over the phone. It is designed to collect data regarding risky health behaviors, chronic conditions, and utilization of preventative services. BRFSS's purpose is to collect state-specific information on these health-related factors and relate it back to leading causes of death and disability. Sugar-sweetened beverage module in BRFSS can be elected by state. One of those states was New York. New York residents were our subgroup, with our outcome variable being the continuous variable BMI for normal weight, overweight, or obese. Our exposure of interest is sugar-sweetened beverages per week as categorical, the categories being none, 0 to 1, 1 to 7, or more than 7 drinks per week. Our covariates were the sex variable, binary for male or female. Age was continuous. Hispanic is binary, yes or no. Race, categorical, as white, black, or other. Education is categorical as high school or less, some college or college graduate. Income is categorical as $25,000 or less, $25,000 to $49,000, or equal to or greater than $50,000 annually. Activity is binary as yes or no for activity within the last 30 days. History of cardiovascular disease is yes or no. Ever diagnosed with diabetes was yes or no. And then for data cleaning, we eliminated any individual who had a BMI of less than 18.5 or greater than 40 in order to exclude those outliers. Soda and fruit drinks consumption was combined and recalculated to all weekly for our SSB variable. Age was recoded to 80 if the individual was greater than 80 years. History of CVD was taken from 3 variables: heart attack, ever told had heart disease, or had a stroke, and collapsed into 1. Ever diagnosed with diabetes was coded using insulin use responses, and all refused, don't know, or not recorded data was recoded to 0 to be excluded. We used complex survey weights, descriptive statistics, simple and multiple linear regression to look at the association of sugar-sweetened beverages and BMI. We did this before and after adjusting for covariates. Then we used CPR plots, residual plot, and a QQ plot to check assumptions. And we did all this utilizing the Status software system version 15.1. So for table 1, these are our demographic and descriptive results. Half respondents were male. The mean age was 48 years. Majority ethnicity was white. More than half of respondents had an income greater to or equal than $50,000 annually. 19 respondents reported consuming more than 7 sugar-sweetened beverages per week. Those who reported no sugar-sweetened beverage intake, 30% were obese and 32% had a normal BMI. Respondents who had reported being physically active in the last 30 days, 81% had a normal BMI. Only 5% of respondents who had a history of cardiovascular disease were of a normal weight. And then those ever diagnosed with diabetes, only 4% had a normal BMI and 18% of those were obese. So for our table 2, this is a simple and multiple linear regression results. For every increase in BMI category, for those who reported more than 7 sugar-sweetened beverages per week, there was a 1 to 2% increase in BMI with a p-value of 0.02. No sugar-sweetened beverage weekly had a decrease in BMI from normal to obese with a p-value of 0.003, so there's no statistical significance association. Our gender, age, and Hispanic variable had lower BMI associations, and no physical activity and diabetes diagnosis showed a prevalence prevalence increased as BMI increased. So our results, the results from this observational study showed a small statistical significance between BMI and sugar-sweetened beverage intake in more than 7 sugar-sweetened beverages per week, though greater statistical significance was seen when compared to the covariates physical activity, diabetes diagnosis, age, race, gender, and college graduate status. More research is needed to further identify associations with confounding factors, and any additional research on specific exposures will play a large role in identifying further obesity risk factors, which is currently a large public health concern in the United States. So proposed intervention would be to introduce sugar-sweetened beverage education and increase access to soda and fruit drink alternatives in New York office buildings. This specific intervention would help address 4 out of the 5 levels of the socio-ecological model. First being individual, where we would increase the subject's knowledge of sugar-sweetened beverage consumption and ultimately change their behavior or attitude. Then on the interpersonal level, it would improve coworker knowledge and support system among the social group. And organization level, office policies on sugar-sweetened beverages would change, and the amount of information on these health factors provided to the employee would change. And then for the community, the employee would have the ability to make healthier decisions. It would be their work environment norm, and it would be more convenient for them to make these healthier options. We would use this intervention utilizing a random control trial. This could be used because it is used to determine cause-effect relationships, and also it helps eliminate bias because intervention outcome determination is used without any sort of third-party influence. Our goal would be to improve BMI status of New York residents by increasing sugar-sweetened beverage education in the work environment. We would use New York residents. We would focus on men who had an income of greater than or equal to $50,000 a year and who have sedentary job requirements, specifically office desk jobs. So we would take 2 office buildings. In building number 1, we would eliminate all soda machines and add water or soda alternatives. Types of beverages and snacks provided in the workplace has shown to impact BMI and choices of employees. Building 2, we would do the same, eliminate soda machines and add water or soda alternatives, but we would also hang infographics relating to sugar-sweetened beverage consumption and BMI around break rooms, kitchens, or other various locations within this office building. Again, previous studies have shown that posters promoting healthy eating in work environments can improve diet choices by the employees. We will provide a 1-year follow-up. Our measures would include a lifestyle questionnaire at the beginning and end of the study to assess for any lifestyle changes based off of our intervention techniques. We would do BMI and waist circumference measurements beginning and end of the intervention, specifically to see if we had a decrease in BMI and ultimately waist circumference measurements, because waist circumference has been associated with an increased prevalence of other diet-related illnesses such as cardiovascular disease. And the specific aim of this study, we want to ask, does increased education and access to alternatives impact sugar-sweetened beverage intake within the workplace? And ultimately, we want to see through the lifestyle questionnaire, are they drinking less sugar-sweetened beverages per week? And has their BMI and or waist circumference decreased over the year? And thank you so much for your time.